Heart failure. The heart is a muscle that pumps blood. To keep your body working normally, it works hard to supply oxygen-rich blood to all parts of your body. With heart failure, your heart isn't pumping as well as it should, so your body isn't getting enough oxygen-rich blood. Fluid can then build up in your lungs and body. This can cause problems such as shortness of breath, swelling, and fatigue. Heart failure is an ongoing or chronic condition for most people. That means that it won't go away, and it can get worse over time. It is important to manage your condition so you can feel better and live an active life. You can help control heart failure symptoms with medicines, changes to your lifestyle and diet, and other forms of treatment. What causes heart failure? Many health conditions that weaken or overwork the heart can cause heart failure. They include high blood pressure, coronary artery disease, heart attack, obesity, diabetes, metabolic syndrome, and heart valve or muscle problems, including problems that you had at birth or those caused by infection or toxins. It is important to work with your healthcare provider to manage these conditions. For example, if you have high blood pressure, treating it early can help prevent heart failure symptoms from starting. What are the symptoms of heart failure? In some people, heart failure doesn't cause any symptoms, especially if it isn't severe, but you may have these common symptoms: shortness of breath with a small amount of activity, shortness of breath when trying to lie flat, shortness of breath that wakes you up in the middle of the night, a cough that won't go away, sudden weight gain, fatigue, lightheadedness, swelling especially in the legs, belly, and blood vessels of the neck, loss of appetite, nausea, increased heart rate, and heart palpitations. How is heart failure diagnosed? To find out if heart failure is causing your symptoms, your healthcare provider will ask you about your health history and give you a physical exam. This includes listening to your heartbeat and breathing. You'll be checked for swelling in your legs and neck. This swelling is called edema, and it's caused by a buildup of fluid in your body tissues. Be sure to tell your healthcare provider about any symptoms you have and all the medicines you take. You may also need some tests or procedures to see how well your heart is working. You might need an electrocardiogram. This is a test that looks at your heart's electrical rhythm. It can show if you've had a heart attack or have an abnormal heart rhythm or an enlarged heart muscle. You may also have an echocardiogram. This is a test that uses sound waves to look at the size of your heart's chambers and their function. This test checks for heart valve problems and shows how well your heart pumps blood. A chest X-ray can show if your heart is enlarged or if there is fluid in your lungs. Blood tests can help find the cause of heart failure. Tests called BNP and NT-proBNP can help diagnose and assess heart failure. In heart failure, these levels are higher. You may also need other blood tests to check for problems in your kidneys or other organs. Your healthcare provider may want to see how your heart works during exercise. Based on the results of your exam and tests, your healthcare provider will create a treatment plan for you. How is heart failure treated? Your healthcare provider will work with you to find the best treatment for your symptoms and to keep your heart failure from getting worse. You may also need to treat the cause of your heart failure. Lifestyle changes are an important part of treatment. Your healthcare provider may advise a diet that is low in salt. You may need to limit the amount of fluid you drink. Staying physically active can help, and you may need to lose weight or quit smoking. Heart failure is usually treated with a combination of medicines. Some types of medicines improve the way the heart pumps. Other medicines relieve symptoms such as swelling from fluid buildup. Medicines include ACE inhibitors, ARBs, beta blockers, and diuretics. Your healthcare provider will talk with you about medicine choices. Follow your healthcare provider's directions exactly to make sure your medicines work as they should. Depending on the cause or severity of your heart failure, your healthcare provider may advise a procedure or surgery to help your heart. He or she can tell you more about the best options for your heart failure. How do you manage heart failure? An important part of managing heart failure is knowing what is normal for you and telling your healthcare provider if you notice changes or new symptoms. For instance, how much activity can you usually do before shortness of breath is a problem? How much do you weigh? Do your shoes fit comfortably? And do you need more pillows to prop you up at night to sleep? Knowing what is normal for you will help you know when symptoms are getting worse. Your normal is called your baseline. Once you know your baseline, watch for changes daily. Your healthcare team will help you put together a plan to track your symptoms daily and check your blood pressure, heart rate, and weight. If you do notice changes from your baseline, take action. Tell your healthcare provider right away if your symptoms are different from your baseline. Work out a plan with your healthcare team on what you should do if you notice symptoms that get worse. You need to communicate with your healthcare provider about your symptoms. Working together helps keep heart failure under control. Things to remember. Heart failure means that your heart can't pump as much blood as it should. Many kinds of health conditions can cause heart failure. You may need lifestyle changes, medicines, or procedures to help you treat your heart failure. An important part of managing heart failure is knowing what is normal for you. Call your healthcare provider if you have new symptoms or changes like sudden weight gain. Work closely with your healthcare provider to manage your heart failure and to improve your symptoms and quality of life. What we have learned. Heart failure means that your heart doesn't work at all. True or false? The answer is false. Heart failure means that your heart doesn't pump blood as well as it should. You might have shortness of breath from heart failure. True or false? The answer is true. Heart failure reduces the amount of oxygen in your body and can cause fluid to build up in the lungs, making it harder to catch your breath.